So what is FACES?
FACES, I would describe, is a youth enrichment program. I was in it quite some time ago, from the years 2007 to 2010. And so we got to do a variety of things. We had part of it was academic enrichment, and so we got to learn things like medical terminology and take courses about HIPAA. And then we also had an externship where we got to apply that knowledge that we learned in the hospital setting. And we were placed one-on-one with a mentor in the hospital. I think our rotations at that time were every 6 weeks. And so we got to explore all of the departments of the hospital that we were interested in.
That's absolutely incredible. Where are you from originally?
From Oakland.
Okay, wonderful. Bay Area native. Where do you currently work, Vanessa?
I work at Roots Community Health Center.
Where's that located?
So we have 2 locations in Deep East Oakland. One of them is on 73rd and MacArthur, and the other on 99th and International. And then we also have a clinic in the South Bay in San Jose. And a number of other locations that aren't necessarily clinics, but part of the organization as well, all throughout Oakland.
Wonderful. That's beautiful. Thank you so much. Now, let's get right on over to Veronica. Please tell me a little bit about yourself.
Well, I was born in Mexico City. I migrated to the U.S. when I was 10 years old. I was also part of the FACES program from 2006 to 2008. And I grew up in Oakland, after I migrated from Mexico. I started living in Oakland. I currently work for La Clínica de la Raza for school-based health centers. Okay. There's 8 school-based health centers, and I work for the one located in San Leandro. It's called Fuente Wellness Center.
Wonderful. La Clínica de la Raza?
La Clínica de la Raza, yeah. It's a nonprofit organization.
The clinic for the people?
Yes.
Wow, very good.
Gracias. Thank you so much. So you said you came from Mexico, so you were undocumented, yes?
Yes.
What challenges did you find that you faced being an undocumented person coming into the United States?
Well, when I first thought about the medical field, when I found out that I wanted to join the medical field, I got hit with the news that I couldn't join any programs or anything that had to do with the medical field because I had no social security number. And also I couldn't go to a university because my parents couldn't afford it. Being undocumented means that you don't get any financial aid. So that was really hard. But also motivated me to still go to school. I still took the classes needed for nursing. Of course, it takes a lot more time. It's harder. And I just had to wait until DACA came the way. So I'm a DACA recipient currently. And I decided to join for medical assistant program because that was the thing that was going to get me fastest to what I wanted to do. But I feel like there's a lot of disadvantages, if you can say it that way. When you're undocumented, there's a lot of programs that you can join, a lot of things. Hurdles. Yes, and you have to take the longest path to get to things, which is great because you get to, how do you say it? You get to value the things more because they were harder.
Because you know where you came from, you value where you are.
Yes, I went through a lot of bullying when I started school because of my accent, because I didn't know the language. I was just sitting in a class and I didn't know what they were saying.
And look at you now.
Yeah, thankfully that pushed me, I would go home, cry for 30 minutes to an hour. And then I was like, okay, it's time for me to study. Yes, so every day I'll go get home and do that, get all my frustration, and then start studying. And I said, I have to get this. I have to learn it.
Yes, but a true warrior.
Yeah. So by 7th grade, I was reading, writing, and speaking in English. So it took me 1 year to learn.
Just 1 year. Wonderful. Thank you for sharing that.
Thank you.
All right. And moving forward, please go ahead and introduce yourself, my darling.
Yes, my name is Tomas Magaña.
Tomas Magaña.
Yes, indeed.
I like the way it sounds.
Thank you. Thank you.
Absolutely. Please tell me a little bit about yourself.
Well, I am a pediatrician who really has particular emphasis on the care of vulnerable adolescents and young adults in our community. I work with Veronica, La Clínica de la Raza, and within the Department of School-Based Health Centers. And my passion really is about improving both, wellness and health outcomes for young people in our community, because they reflect very much the community I came from and my own lived narrative. But I'm also the founder of the Faces for the Future Coalition, co-founder of the original Faces program, which we started back in 2000 at Children's Hospital in Oakland, California.
Okay, now tell me why Faces? How did we come up with that?
Yes. So there's faces. Faces.
I have one. You have one.
We
you
all have
one.
faces.
We all have
so
faces.
why we created the program itself? There are a number of factors, right, and a number of imperatives we wanted to respond to back in the day that really motivated us to pursue, right, an innovative approach and unique approach to providing young people from our communities with the opportunity to explore career opportunities within health. So first and foremost, I think the most important thing that motivated us was responding to what young people were asking for in our clinics. So at that time, I did my training, pediatric training at Children's Hospital in Oakland, and then ultimately served as a staff physician there. And in our teen clinics, as part of our general assessments, right, because the way we practice adolescent medicine is understanding what our young people are dealing with in the context of their lives.
And what do you find that most young people are dealing with? What's the general?
Well, clearly, I think for many of the young people that we were serving within our clinics was the need for kind of goals, right, and financial opportunities.
Okay.
Many of our young people, by the nature of the zip codes in which they reside, are dealing with fairly tremendous social determinants, right?
I like the way you put that.
Right.
The zip codes in which they reside.
We know that zip code profoundly
zip code.
impacts, right, outcomes.
Absolutely.
Right? By no nature of the genetics or by, the decisions young people make, the circumstances of the zip codes in which young people reside often influence and predict what those outcomes will be.
Exactly, product of your environment.
Exactly, right? We all are as human beings,
Exactly.
and particularly young people.
Yeah, absolutely,
When
because that's where they're most formative,
That's exactly right. You're right. And when our communities are unhealthy or stressed, our young people and our children are going to be
They
stressed.
feel it the most.
We do. And I think, my two partners here would agree with that because that is our lived narratives, very much so.
Yeah, but you get through it.
We do.
Absolutely.
Absolutely.
Yeah.
And so part of what we do when we're assessing kind of the health status and well-being status of young people is one of the questions we ask is, what do you want to be when you grow up? What are your aspirations? Because frankly, if a young person, particularly in the communities which we serve, can articulate at least a goal, that is a sign of resilience, right?
Yes.
That is something that you can work with.
Absolutely.
Because the sad reality is that so many of the young people that we were serving had faced such tremendous loss, whether it be family members, friends, or something, young people who had not made it past 20 in some circumstances. This notion of a future, right, and of a career, of an opportunity was not within their existence.
Unattainable.
Not even, not
even
it wasn't even a
unattainable,
realistic,
yeah.
right?
Exactly. It wasn't even an option.
I hadn't thought about it because I
Yeah.
don't think I'm going to be living past a certain year.
Yeah,
right?
absolutely.
So if there is something that is articulated, right, we want to work with that. It's something we can kind of do. And what we were finding is that many of the young people who were coming through our clinics were expressing an interest in health careers.
Okay.
They were either enrolled at one of the pathways
Healers.
locally. It's a universal experience,
It
right?
is.
We
It
all
is.
interface with healthcare in some way.
Yeah, absolutely.
And the sad truth of it is that for many of the young folks we work with and many members of our community, that experience with healthcare is not always a positive
It's
one.
not. I don't care for hospitals or
No.
clinics or anything.
Right.
It's not a positive intake until there are people like you all. There's always that one that makes you feel real good. You're like, okay,
Absolutely.
I'm okay. And so it's your energy, your spirits. I'm going to curve just a little bit.
Mm-hmm.
Maybe you can tell me, do you know exactly why they named the company Faces?
I don't know, but if I had to take a guess,
Mm-hmm.
I would think that it's because we I guess I'm part of it. Dr. Magana and Dr. Staggers, who started the original FACES program, I would think it's because they wanted the faces in healthcare to reflect the community.
Hot dog. Thank you. Is that
Amen.
right? Did you get close?
100%. 100%.
That was beautiful. Oh, you've been saying where you grew up and where you're from, but where is that?
So I'm originally from East LA, East Los Angeles,
Okay,
right?
okay.
The barrio of East LA.
Barrio.
And I was raised by a single mother, first in my family to go to college. First generation, as we refer to ourselves.
Yes.
Grew up in fairly significant financial constraints, shall I say.
The zip code?
This is by nature of my zip code. Absolutely. My mother was a teenage mom. My father and other men in my family were in and out of my life. So there was struggle, of course, right?
Absolutely.
There was struggle. And certainly understanding that narrative, being the first and confronting many of the biases and barriers which exist for folks who come from where we come from, the zip codes where we come from, that's part of our narrative.
Yeah.
But I think the thing that resonated with me most profoundly when I was young, and which I tried to bring back, right, is that there were certain adults who come into your life at certain momentous moments, when they see you for who you are, right, you are actually visible to those adults. Those moments can transform. And had there not been those caring, right, adults who had entered my life and saw me for that time, my trajectory may have been very different. And we talked about this, right?
Absolutely. But you're sent guides and gurus whenever you need them. They'll come to you.
I truly believe that.
In a whatever form or fashion.
I truly believe that.
Absolutely.
Right.
When you need it. Not when you
Indeed.
want it, but right on time.
And you're not always aware of it, right?
Yeah, exactly.
But you're not.
You don't realize it. And sometimes it's a tough lesson
Indeed.
from them, but you receive it. Okay, so what brought you to the Bay Area?
So when I was 13 years old, my mother made the decision that we needed to make some changes and kind of get out of where we were. She needed some new opportunities. She knew I needed some new opportunities, so we moved up to the Bay Area.
Okay.
And established this as my home from that moment onward. So I'm kind of a person of two worlds, Los Angeles and the Bay Area.
Yeah.
Plus my Mexican background as well, too, right? My family's originally from Mexico as well. Yeah.
Exactly, so that's why.
Yeah. Well, first of all, we believe in the capacity and the innate capacity and innate talents of young people, right? We start from that place of young people already bring the strengths and the assets already. Simply they're
fully equipped.
They are fully equipped, frankly, because of the necessity sometimes to survive in the situations which you are. And not only just to survive, but frankly to thrive.
Yes.
Come on, let's just call it what this is. We may interpret it, right, as they're just getting by or they're struggling and so forth. But the reality is that many of our young people, and these two young women are a perfect example of that. Beto just talked about the way she thrived, right? And Vanessa has not shared her story, but I know how she has thrived in the face of adversity.
Yes.
We know that they bring those talents already.
Absolutely.
That's absolutely right.
I think like you mentioned, or like Dr. Magaya mentioned, is like those mentors, people that show up in your life in the moment when you need them. I think that's what, that resonated for me because that's what he did for me. Yes. And that's what my, when I first heard about FACES was by my teacher. And so they both showed up for me when I needed it because I wasn't even thinking about health myself, but just having the right people in your life and
plant that seed.
Yeah.
Absolutely.
And, the fact that I'm lucky that I continue to have that person still watering me.
Yes.
That's what he does.
And vice versa. And the skills that they bring, right, that we know young people bring are actually the skills we need within our healthcare workforce. Because those are the skills that promote trust and connection with those in the community who are being served. We build upon that. So our young people not only bring kind of the representation of the diversity of our communities, not just by the nature of kind of their race or ethnicity, but also because they understand the lived narratives that our communities are facing.
They're basically the tools for advancement.
Absolutely. We, healthcare and our workforce desperately need that representation and that knowledge if we're going to address some of the issues around mistrust and health disparities, right? And the broken fragmentation of our healthcare system. So, it is bringing the faces. We change the face of healthcare by bringing the face of students into the fold of our workforce. And so that's where we always start, from that place of asset, right? And strength.
I love that.
And then build upon that.
Thank you. I'm going to move over to you. Now, you don't have to answer. Okay. But he was responding, you don't have to answer, but he was referring to some hurdles that you had to overcome in order to be here and being this beautiful being you are today. Would you like to give a little bit about that?
Absolutely. So I actually grew up here in East Oakland, not too far from where we're recording, actually. And both of my parents suffered from substance abuse disorder, and my grandmother was or is an immigrant to this country as well. And so a lot of the time we spent, my brother and I, with my grandma, and she helped raise us quite a bit. And so even just growing up in the area during the early and late 90s, early 2000s, just to kind of paint the scene, the area I grew up in on 26th Avenue is considered like the prostitution ring.
Copy that.
Of Oakland, or one of them, I should say. And I remember being maybe about 4 years old, and I remember the first dead body I saw was 1 block from where I lived. And then shortly after that, I saw more. And so just dealing with all of these things and kind of, I think my internal dialogue started to ask questions, right? Why is this happening here? What does this mean? And just start to think more deeply about some of those issues. And so by the time I got to high school, I never really thought of myself as a scientist or someone who thought they had an interest in science. But I remember having a teacher in the health academy, Mr. DeLayu, who was like, kind of noticed that I asked some important questions and noticed some of my strengths. And long story short, that's how I sort of ended up finding out about the FACES program. It's like, this is interesting. And I think I might try this out. And so I think, outside of FACES, just offering a place to be, a safe space to be, and being with peers and being with, adult mentors, it also allowed me a space to explore some of those questions I had. And maybe I wasn't exactly thinking about it in that capacity at that time in my life, but definitely in retrospect, can kind of see how that took place. And so I think what you all were just speaking to is sort of, what does FACES do when they first get these kids? Like, what do you do?
What do you do with these?
I think for me, and I think Vero articulated this really greatly as well, kind of pointed to, these aren't necessarily disadvantages. These are actually some of your strengths.
Exactly.
And these are actually, qualities that have built your character and
life experience.
Lived experience, have helped you build connections with people. And this is a way that you can apply them to continue to help people like yourself. And I think that's what...
Are we just saying you got to go through it to gain perspective?
Exactly.
Yes, those are your building blocks.
And that allows you to connect with other people who might be going through those same things.
And it helps to realize you're not alone.
Absolutely. And I think that's even why I'm in a space where I'm comfortable sharing my story, because I remember when I was that age, no one knew those things about me, or no one knew the details of what I had been through. It wasn't until I had like a comfortable space and someone I trusted who could also, share his story with me and be like, well, I've been through some of this too. And then it was like, okay, I'm not holding all this weight anymore. I can trust this person and communicate with them about some of these things. And he could reflect back to me, these are strengths, and provide a space where I could connect with other people who might be experiencing some of the same things, and just continue that chain of trust.
Exactly.
Because I think one thing that I do know about the community I grew up in is that relationships aren't always built on trust. More often than not, they're transactional and definitely built on respect, but much less so on trust. In fact, I think a lot of us were taught, don't trust people.
From jump, exactly. Yeah.
So I think that was a really important piece of my experience at Faces. I kind of, my perspective shifted.
Yes, you gain perspective.
Absolutely.
Most people that come into our lives are really seasonal in the first place. And so you don't necessarily have to trust them, just utilize them.
Exactly. Transactional.
Yeah, exactly. Yes, I love that.
Absolutely.
Just utilize them. They're there for a reason, and it's always for your greater good, whatever the case may be.
Yep.
What can you teach me? Now get out.
I think that's definitely true to a certain extent, right?
Yeah.
There are some folks who are destined to be there for a temporary moment, right? And we can benefit from that interaction, hopefully, assuming that it's a benevolent, right,
even
intention.
If it's not, you find the good in it.
Absolutely. But I also think it's equally important, particularly for youth and young people, to have kind of that trust that there is long-term relationships which are safe.
Yeah, absolutely.
Right? And that are consistent and that are reliable. Because as I think for many that come from certain backgrounds in certain places, right, there are adults who walk in and out regularly who should be consistent. Right? Should be consistent. That was certainly my narrative. And, I think part of that milestone of an adolescent development that is so critical is being able to rely
on someone. Just anyone.
Right?
It doesn't have to be a bunch of folks. Just
that I am, that truly sees me and hears me.
And has seen me for everything that I am.
Exactly.
The light, the shadow, everything. And they still love you.
Yeah.
No doubt.
Absolutely.
No doubt.
Especially when you went to different struggles.
Absolutely.
And, first generation to go to college, maybe your parents, there's some parents that maybe don't encourage their kids as much. And you need that one person that can tell you, like you guys said, I see you. You can do it. I see your strengths.
Absolutely.
Yeah, keep
Come on,
pushing.
get up. Let's go.
Yeah.
Right?
Yeah, everyone needs a good one. Yeah, so when you find that person, hold them tight.
Indeed.
Yeah. How many places can we find Faces? What cities are we in?
Yeah, so the program originally started in Oakland, right, at the Children's Hospital. And at that point, we were serving young people from the East and West Oakland corridors, as well as South Berkeley. And we very purposefully targeted those young people who had historically been excluded from school to career pipeline programs, right? Yeah. Again, from multiple circumstances, either because of the zip codes in which they resided. Programs were reliant upon certain GPAs, right? We made it very clear that GPA, there was no requirement to enter Faces. We wanted to reduce those historical barriers to be able, the limitations, right?
Lots of them.
So that young people who we need in healthcare actually have the chance to learn that and to get there. Exactly.
Yeah.
And I think we, again, we can certainly Faces and the village of people that comprise the work of Faces, right? Yes, my partner and I co-founded it, but the truth is that there was an entire village of adults.
It takes a village.
Right?
You can't do it
that
by
were in
yourself.
some way impacting and helping and supporting these young people, their families, their teachers, our hospital staff, my team, so on and so forth. Much of it was done just out of volunteerism and a spirit of wanting to do better, right? And do right by young people, right? Many of us were in pediatric care, so this was part of our value and our imperative to help. We became, because of all of that, and frankly, because of the profound strength and resiliency of our young people who got into colleges and graduated from high school. I mean, we have to think, right? 100% of young people who were enrolled in FACES programs graduated from high school. And this was at a time when we started that I think the graduation rate for high school graduation rate in Oakland at that time was petering somewhere around 40 to 50%, right? Right? By the nature of that. So the fact that these young people were graduating from high school, despite the barriers, was huge.
Yeah.
So to answer your question, we started in Oakland, and then ultimately, because I was working in South County at that time as a physician at St. Rose Hospital, there was a tremendous need in South County as well. So we brought the program down to South County, and that was our first what we call replication, but it's really not. This isn't a franchise model, right? And then it grew from there. So currently we have programs throughout California, Sacramento, San Francisco, the East Bay, San Diego, several programs in the East Bay, but we also expanded nationally. And I built a program in Albuquerque, New Mexico, which serves the Native American population there, as well as the diverse Latino community there. Colorado, did some work in Detroit, Michigan, and are now thinking about expanding to Washington.
I love that.
Yeah.
My family is in Toledo, Ohio.
Oh, really?
An hour away.
All right. Well, let's talk. We can bring it there.
Exactly. Please. We need it. They need it there so badly. I want to get to this very important statement. What is the mission statement of FACES?
Yes, I can paraphrase the mission statement if that helps.
Yeah, let's paraphrase it.
Paraphrase it. It pretty much says that through the investment in young people, right, a comprehensive investment in young people, and through their transformation, we can ultimately transform healthcare.
Okay.
And the way it is practiced.
Yes.
And transformation both not only by diversifying our workforce so that it better reflects the community which we serve, right? But by bringing the skills, the talents, the power, the agency that our young people reflect to the practice of healthcare.
Yes.
Right?
That was very good. I think you paraphrased that nicely.
And I think that's one element of it. Okay. But I am ultimately a healthcare provider. I'm a pediatrician. So while, yes, workforce development is important, my main goal is that we impact the well-being and lives of kids.
Of the kids. Yeah.
Right?
They are our future, literally.
It is a future. And when we're thinking about that the three leading causes of death of teenagers in this country are trauma, homicide, and suicide.
Really?
That is the three leading causes of death in teenagers, young adults in this country. Those are all preventable.
100%.
Right?
Absolutely.
Our young people are not dying from disease, from infection, from cancer. They are dying because our society is ill.
Yeah.
And because we have not done the appropriate investments in education, enrichment in children that are necessary to keep them healthy. The well-being and welfare of children is not a national, in my opinion, a national priority for us.
Your opinion is very correct.
Right?
Yeah. They don't care.
And so ultimately right?
Yeah.
So ultimately what we strive to do is FACES is ultimately about youth health, adolescent health.
At the end of the day, FACES is about youth health.
Mm-hmm. This is true. I remember, I think you piloted like another program when we were in there for our cohort. Or you invited someone in to teach us meditation practice.
That's important.
And I'm totally blanking on the gentleman's name. But he also had a background of being like from the community. He shared his experience with us about, I don't know if you remember. I don't know if it's the same class, but he shared his background about being incarcerated and all of these different things. And he taught us how to meditate. And I remember at the time, like, friends who were in the program and like, what are we doing? Like, why are we doing this? I don't, like, how is this related?
Yeah.
But I remember thinking, like, it's actually very related. Like, they are caring for our mental health.
Exactly.
Like, they are teaching us, giving us a toolbox of how to create a safe space for ourselves.
And calm your
I even
brain down.
remember the meditation, and we would close our eyes and all sit in a group and envision what our safe space looked like. And I remember that.
Visualization is important.
Absolutely. And so I think there's a couple things there that are important. I think definitely the connecting piece of who was there teaching us this and how they were teaching it, their approach. But then also like the tool itself of how to, this is one way you could care for yourself, or like one way that you can generate some mindfulness. And I still meditate. It looks a little different, and I think meditation looks different for everyone.
Yeah.
But I remember even when I was working at La Clinica in school-based health too, at one point, I remember like thinking, okay, but before we do our huddle, before we start the day, I think we all need a 2-minute meditation together.
I remember you doing
We
that.
need to just breathe. And
right.
Get as much
I'm
air as
kind
you
of just
can. It's
realizing
free.
now that it sort of came full circle.
Yeah. Look at that.
Indeed, it did.
And I think some of the people maybe didn't understand because we were not facing so much mental health need at that moment.
That makes sense.
But right now, I think that things have changed, right? But the good thing about learning those skills is that we can bring it to the young people that we serve at our clinics now, right? Because I think that's an important aspect of it. Like, we learned it maybe at that moment. We didn't think it was important, but now we see it because now we see the youth and we see the need, and we're there like to mentor them and to support them, because that's what we do on a daily, like Dr. Magana said. And I think that we are now the face at the healthcare because, if something happens, we're there.
The face
people
that they
see
can
us.
trust.
Yes. And, now I get to help a lot of these immigrant families. And unfortunately, there's a lot of need in mental health. But learning these skills is what helps us now to keep encouraging our staff, our patients,
Yeah, I believe that
to
if
look
they,
in the future.
if they put meditation in schools, it would fortify their brains a lot better to be self-aware and to recognize when they need to kind of shift gears, because your mind can go crazy and take you to places. Exactly.
Absolutely.
So if you were aware of that from a very early age, you could tap into that mentality and I believe have more control over your circumstances and your environment.
When I was part of La Clinica, sorry to cut you off.
No,
Dr.
please.
When I was part of La Clinica and I was working at the Roosevelt School-Based Health Center, we did try to pilot this with one teacher. I'm forgetting her last name, but Whitney. And she would meditate with her students when they came back from lunch. They would all do like a short meditation, and she noticed the difference. I think even thinking about that, having healthcare in the schools and school-based health is so important, because we were able to fund that through our funders and our grants, those learning opportunities for folks in a different profession teaching. But really, it's all the same.
It really
We're all
is.
connected.
It's full circle. And we're all connected. We all operate the exact same way.
And if I could just kind of add, on that note and kind of elaborate, one of the core, we have 4 pillars of the FACES paradigm, and one of the most important is this notion of wellness.
Yes.
Right? Because we understand that there is a connection, right, in the pursuit of one's education and career, when you are often the only alone trying to navigate this or kind of deal with the realities of one's life and situations, right? Those stresses can really impact one's performance.
Yeah, absolutely.
And so we made it very intentional that we were going to include wraparound services and wellness services within the training of the program. So within the context of career exposure and training, wellness was an integral piece of this.
What is a wraparound?
So wraparound is really providing those social support services that address the challenges that a person is facing, right? So first of all, that means every intervention you do, the programming has to be youth-centered, youth-focused, client-focused, as we say, or patient-centered focus in medical terms. My team here knows this.
Yes,
right?
yes.
But in order to do that, you have to assess what's going on.
Yeah.
So that means you talk one-on-one and you ask the questions, what's going on in your life? How is home security? Do you have food? Do
Almost
you have...
like a hug, a wraparound.
It is.
Yeah.
Right? Because it is those circumstances,
that's caring.
right, guys,
Yeah.
that are going to prevent. Look, young people, for the most part, we're not attending school because of lack of motivation or for lack of desire to learn. Many young people are missing school because they have to attend to what's going on at home. Or they may not have they have to work 3 jobs, right, to support paying the rent, or to go accompany their parents to interpret at a health appointment, right? Those are the realities of what our young people were facing, which were impacting their performance at school. We jump to this conclusion, right? Particularly young people of color are not doing well in school because they're not motivated, because they're troubled, they're marginal, blah, 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 all that negative image, those messaging. But the reality is when you do take a moment to understand the reality, it is because life is impacting their ability to excel.
They're tired.
It's a privilege to be able to go to school unencumbered, right?
Yeah.
Without the realities that your parents are not thriving. Right? Or your siblings are not thriving. And so wraparound means is that you want to optimize a young person's success by providing those resources that they need and address those gaps so that they can actually focus on their goals. And wellness is a part of that.
Yes.
Right?
Yes.
Not just addressing these, but also giving them the tools and the skill sets, right, to address the profound stress that young people can often
I
face.
think even just the starting point, just asking, just inquiring about what is going on.
Yeah.
That's right.
Yeah.
Because I think a lot of times there's no space for that or there's no time for that. I mean, I think our teachers are inundated with so much work, especially in Oakland. They have over 30 students in each class.
Huge
and
workload.
it's, it does take a village. And so I think even just starting by asking the question, and then you have a young person that a light goes off and they're like, oh, no one's ever asked me that before.
That's right.
Yeah. I love that. Yeah. How is FACES so beneficial to, say, first-generation students like yourself?
That's a great question, and then I think we have a couple of other first generations here
as well. Okay,
that's absolutely right.
I'll answer that.
I think
answers from home.
I can just provide from my perspective, right? Having gone through the journey without a program like FACES, right, to support me, is that as a first generation, you're often just trying to navigate this on your own, right? You don't know what the resources are, you don't know what mentorship means, and the value of it is, as Vanessa had articulated, many of us grow up with this notion that to ask for help is a sign of vulnerability and weakness.
Yes.
In Spanish, se lava la ropa sucia en casa. You clean your dirty laundry at home.
Keep it in the house. Keep it in the house.
Keep it in the house. And that's certainly the way I grew up.
For outside influence for help.
And you know that in order to build social capital, right, and to move forward, you have to ask for help. You have to build that network.
Yeah.
It's essential. We don't grow up with parents who can provide us with those connections and those networks necessarily. Or we don't have colleagues, right, who can provide us with internships and career explorations. Yeah. That's often the universal experience for a first-gen person. So a program like FACES fills in those gaps, right? Provides that mentorship, the resources, and teaches young people that, number one, as has been articulated, it's okay to ask for help.
Yes, please ask for help.
Please ask for help, in fact. In fact, there
are no dumb questions.
Exactly.
Yeah.
Right?
Yeah, not knowing is worse.
Yep.
It's because I think in our culture, sorry to
Please.
interrupt. I think in our culture, our families are very close-minded, right?
Exactly.
And so we
judgmental.
don't explore things because they're just close-minded. We need to stay in that square. So to me, Faces was really helpful because also the mentors that we had, I remember one of the mentors, Louisa Higgins. She's a psychologist, and I had those struggles and those questions and things that I couldn't ask my parents, or that perhaps problems that I had at home that maybe I would have been in trouble if my mom found out at that point that I was sharing, but she helped me a lot without, just by being my mentor in my internship. She told me, read this book, you're going to find a lot of answers there. And she helped me thrive, she helped me go back home and be happy and appreciate things, even if I wasn't, at the perfect household.
Mm-hmm. Yes, it just takes one person to care.
Those things are really important when you're trying to figure things out. And like Dr. Magaña said, they help you figure out how to do a resume. How are you supposed to interview at a job? How are you supposed to present yourself?
Exactly.
Things that perhaps you don't learn elsewhere.
Yeah, exactly. It has to be taught.
Yes.
You don't just come fully equipped with it. Vanessa, what were some of the challenges you found as entering the workforce for the first time?
I think just not knowing. There was like a lot of mystery. Of just like my parents didn't necessarily have a career or a profession at that point, like an industry they were in. They hadn't been to college either, and my grandmother hadn't because she was an immigrant here. But I think Faces allowed that space to ask questions. I think what Veronica Vero mentioned is really important. Like our culture is not, kind of steering us in the opposite direction. Don't ask for help.
Yeah,
not a good idea.
That's the way they were raised.
Let's keep it in the house.
Yeah.
Right? Yeah. But I think that's still actually a challenge for me, asking for help. But I think where I started to learn that that's really important is in Faces. I'm like, oh, okay, like how am I ever going to know if I don't ask?
Exactly.
And then building network and connections with people. Like I mentioned earlier, I feel like growing up, it's really based on respect and transaction, but there's no trust. And so to thrive in a professional environment, and I think even just higher education, you have to ask for help. You have to build connections with your professors and your manager and other people who are in the field to be able to build on that. And so I think that was always a challenge for me, asking for help. And I had a safe space to explore that with Faces. And then I also had just a really great demonstration of what it looked like. All these health professionals working with each other to help young people and communicating.
The power of connection.
The power of connection. The power of communication, healthy communication.
Yes.
What it looks like. Representation as well, too.
Yes.
Absolutely.
It pays to see someone that you can relate to.
I think, like Vero mentioned, having those different mentors in the hospital. I remember all of the folks I shadowed at each of my externships, I remember them being people of color in the hospital. And I always thought that was really cool because I hadn't seen it. I hadn't seen it. So
not for a long time.
Being able to have each of those mentors and, having some comfortability with them.
Safe space. Yeah.
A safe space.
Definitely.
And just seeing someone who looks like you or who can express that they've shared similar lived experience was really important.
Really, the sad reality is I cannot tell you the number of Faces students who told me that I was the very first Latino physician they had ever met. And I guess I should not have been surprised because in my entire childhood, I had never met anybody who was Latino, and represented kind of my narrative and my cultural background. So there is tremendous power in representation. I think when the young people were rotating through the hospital, clearly the patient population is made up of our community.
All of us.
Right?
Yeah, absolutely.
But when you looked at those who were caring for them, You know, even though they bring their heart to it,
It's a different type of care.
it wasn't always representative.
Yeah, exactly.
And I'm glad, you know, and we were very deliberate about trying to identify mentors and preceptors for FACES students who did represent kind of that diversity of lived narrative for them, because young people need to see themselves, right, reflected in that in order. And the other part of it was in having those experiences, young people were also able to identify what role they can play in actually providing care.
Yes.
Right?
I think it totally
placement.
comes full circle because this is also a way to build connections with your patients. Like me and Vero both work in community health clinic setting. And so, you know, I remember exactly what Dr. Magana is talking about, what the patient demographic looked like and what the provider demographic looked like. And that's another barrier.
Yeah.
When your patients aren't able to build connections with you or be able to relate to you, or I guess in simpler terms, have any trust for their provider. There's a lot that they might not share that would actually help them receive better care. And so now that we both work in the community, but I could speak for myself, just being able to work in the community, in my own community at that, that's really important. My patients and the folks who I work with, knowing that I'm also from the community, we could just relate to each other on a different level. And there builds some trust, even outside, because I don't do direct patient care anymore, but even just outside of that, having those conversations about, you know, what's going on or, you know, how their weekend was, and then being comfortable enough to share, makes them comfortable in that space. And then they feel good about coming there, and they feel good about meeting with our providers who also look like them and chatting with the front desk for a little while. It brings us back to this, like Dr. Magana mentioned about the program itself, just wraparound services, holistic care, caring about the person. Those are all really important factors in providing health care.
It makes it familial. You know, it becomes a family.
Can I say that that's what made me decide that I wanted to be in healthcare?
That was my next question for you. How does it make you feel to be able to give back to the community you grew up in?
So it's amazing. Like that is what actually made my choice. Like I want to do something in healthcare, specifically nursing, because you care so much for the patients. You have so much interaction, and I saw myself in all those patients. You know, people that got their struggling and say like, oh my God, I don't know how I'm going to say this. And then I was like, you know what? Let me help you. I'll translate for you. Because I know the struggle that it is to not be able to share your feelings and what's bothering you. So, you know, I do that now. Don't worry, I'll translate for you. I'm gonna help you, and that is the amazing thing of it. Right now, being able to give back in that way, because I see myself. Because I don't want people to struggle. I don't want people to feel like they cannot be understood. You know.
And you had to go through it so you could.
So I have
the next generation.
I have that love for my community, for the people, and to be able to serve them is, you know, a dream come true. For me, you know, being able to give back a little bit of everything that that was given to me, and most important, to be able to help others communicate and help them heal.
Yes. Here's the healing and walking in your purpose and going through life to gain perspective so that you can pass that knowledge down to someone who needs it. So all of this is wonderful. Moving forward, how do you envision FACES kind of making an impact in all these, what do we call them? Affected by their zip code. How did you put that?
Exactly.
A product of their zip code. Yes. Okay. How do we see that moving forward?
By building this generation of folks.
Yes.
That's how we make progress.
That's how
right?
we move
By the
forward.
investments in our young people locally, so that they can carry this and move this forward. Right? The power is in this generation, honestly.
Give you the handles to carry it.
Serious.
Yeah.
Right?
Yes.
So that I can retire.
You did the legwork, you did the groundwork.
That's
we are
right.
so grateful for you.
The roots have been set, right?
Exactly,
Literally.
Yeah.
And,
You
Roots
just
Community
gotta
Health Center.
water them.
Right?
Put some sunshine on them, shine bright.
And of course, look, I mean, if anything, with this pandemic, right, this pandemic we've been through has highlighted and really magnified was that these disparities continue. And if not, in many ways, as we've already said, they're worse than they ever were before. So the imperative for programs like this are more important than ever. Number one, we still need to build a diverse workforce that is culturally, linguistically, right, and ethnically representative of our community. We still have a long way to go.
Very, very much so.
We still have a long way to go, particularly as the demographics of our community continue to diversify, right? Our young people are facing probably more challenges than they ever, even at the 20 years ago that we started this. We talked about the mental health challenges that our young people are facing.
And social media does not help.
It certainly does not help. The negativity, right,
All
around
of
that, the cyberbullying.
gratification, comparing your life to something that isn't attainable, that it's fake.
And that is really not right. That doesn't have meaning to it,
No,
right?
it doesn't, and it messes with a young person's psyche if they're not grounded.
Indeed.
Or they
I
feel
think
they're
Dr.
behind.
Magana and I were talking about this like maybe 2 weeks ago because we were talking about, of our patients and our patient care. And we were mentioning, and I mentioned to Dr. Magana, you remember being like this when I was in Faces? And he said, no, but you guys didn't have all this, phone technology and,
Access
the
to
Facebook, the
everything.
Instagram and all of that stuff. And we were talking about social media and how much it impacts the youth now. Because I asked him because I was like, maybe I didn't notice it when I was at that age. And he did, but he's like, no, it wasn't what it is now.
It's a different
It's
world,
such a different,
right? And it's a post-pandemic world, right?
Which is even harder.
The fabric of our communities was really disrupted by this pandemic.
And technology is taking over.
And technology is taking over and so forth. And with this, right, so where we need, right, to grow and expand is we need to build our behavioral health workforce. We simply do not have enough mental health providers to meet the need right now, particularly those, again, who are representative of our community. So that's an area we are going to build and to continue to expand. And then just in the areas in terms of our own programmatic stuff, really building youth development experiences, empowering our young people with knowledge to go out and do outreach activities. We did a COVID peer educator program during the pandemic. We just now have a grant to empower to train our young people to be educators around substance misuse, right, for their peers. Those are areas where we can continue to grow. And I think that, with regard to where we need support, right, obviously funding, because it's always soft money.
Next question. I'll hold on to that one. Go on. Continue.
Okay, but I'm kind of jumping right. But of course, our program is based upon soft money, right? And the investments.
It's important.
It is.
Yeah.
And so that's a big part of my job is trying to
cause.
continue to raise those funds. But as we mentioned before, the only way programs like Faces get done is through the volunteer spirit
Okay.
of our larger community.
Yes.
Healthcare providers who mentor and precept, healthcare organizations would say, we want to partner with you.
Yeah, exactly.
Right?
So that brings me to this.
Yes.
How can our listeners get involved and support Faces and contribute to the next generation of healthcare professionals?
You guys want to?
How can they assist? How can the world help this thrive and push forward?
Well, I think like Dr. Magana said, right, we're always looking for funders because if you invest in the youth and if you believe in them, you're going to be that one person who's going to show up for them and be there for like he was for us.
Yes.
We need more people to care for our youth. Right now in the clinic where I work, we try to do as much programs as we can for those kids, but they need more programs. There needs to be more guidance, more people listening. There needs to be more things for them to be entertained, to learn. I don't know if you have something.
I think also what Dr. Magana mentioned is just the partnerships and having those, those of us who are represented in healthcare, who are actively in the field, extending a hand back and saying, come what?
With me.
Yeah.
Yes.
Come shadow or come see what I do for a day or, just noticing strengths in a young person and putting them in a position where they can gain the hands-on experience. And sometimes they might even say, this isn't for me.
That's right.
Like, I don't like blood, and I don't like looking at wounds.
Yeah.
But then you can start to open other doors of,
See where their strength
this
is.
isn't all of what healthcare is. You might be able to help someone navigate socially, for social services.
Exactly.
You might be able to offer behavioral health support.
Yeah.
Maybe you're a good
Occupational
listener.
therapy, yeah.
Therapy.
Anything.
I think
There's
that's
a place.
a huge part of what FACES does is offers the exposure to all of the different paths you can take within healthcare.
Yes.
And so having those partners and people in the community or in healthcare, whether it's the hospital or a community clinic or, some small behavioral health clinic, just taking on a young person and helping them in that way.
I love that. Now, as a listener, and I have some money in my pocket right now, right? Where do I go to give this money to you?
Thank you for asking.
You're welcome.
We are, so the FACES Coalition, which is our headquarters, right? Our national headquarters, which is based here in Oakland, California, is a project of the Public Health Institute. That is our kind of fiscal and organizational partner. So every donation is tax deductible, in other words, of course. But if you are interested, you can go to our website, facesforthefuture.org. And you can reach out to me or one of our staff members, or there's actually a donate button on that website as well, too.
Say it again.
www.facesforthefuture, all one word, .org. O-R-G.
Wonderful.
Okay.
Thank you so much.
Thank you for asking about that.
Absolutely. It's important. I mean, the work is there to be done, but you can't fuel it without a little cash.
That's it.
Yeah, that just come down to the bottom line. I need some finances.
You need some finances and resources, and
it's an investment.
It's an investment in our future.
In the future.
It is.
Yeah.
Look, at the investment in our children and in our youth is perhaps the best investment and most noble investment we can make as a community and as a society, because it is our children which are going to carry it forward. We are investing in our future and our well-being, right? By the investment of young people. And these two are an example of that. They are now attending to the health needs of our community in their current roles. And I just have to say, as we end, and it's just as the anecdote of kind of that power of mentorship. So I met these two when they were 15 years old, okay? And so I knew them when they were young.
Younger.
And we've known each other for a long time. Now they are well-seasoned adult professionals doing extraordinary jobs.
Very cool.
But Vero, do you want to share what you told me back when you were 15 years old in terms of where you wanted to work? What you wanted to do?
Do you remember?
You wanted to work with...
I remember I wanted to be in nursing, and I was sitting down, in one of the lectures, and I thought about it, and I said, my dream will be to work with this man one day, right? One day I want to work with him. And I remember telling him that. I remember telling him, I want to work with you when I grow up. Yes. and when I become a nurse, I want to work with you because I have such admiration for him. And because he invested all his time in me. And, he's like a role model for all of us. And right now, currently, I work with him. And,
She's my clinic supervisor.
That's amazing.
I love that. Look at the story.
She is now my supervisor, one of my supervisors, right? And both of these young women played that role of supervision in my department. So we've really, truly have come full circle.
Yeah, you have.
Full circle.
Absolutely. Well, loved ones, thank you so much for being here with us today at HHREC. This is Phoenix Rose signing out. Faces, y'all.